Thank you. It's good to be alone here. So one thing I think, why is it really important, healthcare? Because, 1 out of every 6 people in the world is actually an Indian. And in 30 years, 1 out of every 5 people will be an Indian. So obviously a large population, large challenges, and a large healthcare problem. If you look at India also, it's a unique mix of all the global healthcare systems. So wherever I've been in the world, something of every global system is. So some of the corporate hospitals are pretty much like the academic medical centers in the West, both in terms of infrastructure, but also in terms of the way they're funded from insurance. Then the private hospitals, the private practitioners. So we have this whole microcosm. So in a way, Indian healthcare could be anywhere in the world. Private sector is growing, but still, healthcare is elusive for a large section of the population. Health insurance, but, again, the second most important reason why Indians go below the poverty line is an episode of illness. We have a lot of medical graduates, but again, our physician density is among the lowest. We don't have some of the basics which even come before healthcare. So, we have this really embarrassing statistics that more Indians have access to a mobile phone than to a formal toilet. So one of the things is GDP increase in healthcare. Today the US spends 18% of the GDP on healthcare, but still the outcomes are not good. From that perspective, we spend 5% of our GDP. Can we afford to go to 18%? Should we build more hospitals? And like some of my colleagues said, most of the healthcare is now going to take place outside hospitals. So why this traditional thing of building more hospitals? Expand the government insurance coverage. Positive, but there may be negative ramifications. Today, why a lot of Indians are healthy? Because they can't afford to be sick. So you're the biggest stakeholder because you don't have the money to be sick. So what's changing in Indian healthcare? I think these are the sort of 5 changes which are really going to happen. One is the government moving away from a provider to a payer, and we spoke about universal healthcare. The second thing I spoke about, accessibility, geographical, financial, but the last one's important, technological. As we said, that's something which could leapfrog us. The third part is we're having an unbundling of hospital services. So you're having eye care chains come in, you're having the mother and child. So anything which need not happen in a hospital is moving out. We are redefining the medical skill sets and innovation. And I'll briefly dwell on some of these. So these are the 3 major changes. And these changes are not only limited to India. Regulatory reform, sector industrialization, and healthcare is getting more personal. But the things it's got to look at are 3. It doesn't look today at what it costs, because today costs, again, they're not transparent. Second is outcome. And the third, I think in India, as you become a peer, and this is an experience from the United States, today the United States has $272 billion in fraud. So that's something the government needs to contain. Intelligent use of technology, I think very important. What we refer to, we are a superpower on technology, but we don't use it on healthcare. M-Health, which we spoke about, a lot of business models are emerging in M-Health, and they're trying to penetrate. So the next leap will be in healthcare will probably come in mobile health. So just as an example, in India you have 0.6%, 0.6 physicians per 1,000, while in the UK it's 2.2. So M-Health in India actually addresses a pressing need. In UK it's a luxury, and that's the reason why in India 88% of the respondents to a survey we did said M-Health's important, because you don't have any access. So getting some sort of access is very important. A lot the government can do in terms of health system strengthening. So today, if we say we don't only have a dual burden of disease, it's not only that you have acute disease, chronic disease, but India always faces a threat of a pandemic, and we just don't have a mechanism for that. And M-Health can be very useful for that. When we come about 10 years later, I think in this room, we won't be talking about beds. We won't be talking about the traditional way of delivering healthcare. We're going to talk about something else. And in a way, whatever happens in India is going to impact healthcare globally, because what we've shown is we can radically reduce the cost of healthcare delivery. We can improve access, enhance quality, and like I spoke, we can be the crucible for mobile healthcare models, which can be replicated globally. So I think for all of us, it's a very interesting space. It's growing very fast. You really need to move at a fast pace, because whether you're any stakeholder, you're a provider or a payer, I think to stay competitive in healthcare, you need to be running to stand still. Thank you.